Alright, so welcome to muscle anatomy question series. Alright, this is day 23 of our series. So let's get right into the question. Today, we are looking at a clinical case of myotomes and dermatomes. Okay, a 45-year-old construction worker presents with weakness in his right hand. On examination, he has decreased sensation over his pinky finger and difficulty making a tight fist. However, his ability to extend his elbow and flex his bicep is completely normal. Based on the clinical presentation, which spinal nerve root is most likely compromised? So your myotomes actually is an area of is group of muscles that is supplied by a single spinal nerve root, and which is ventral, right? The ventral root of the spinal nerve, and then the dermatomes is the area of the skin supplied by a single spinal nerve root, okay, and that is dorsal, right? So a spinal nerve root can have ventral and can have dorsal. When it is ventral, it is motor. When it is dorsal, it is what? Sensory. Now, this question now says that there is decreased sensation over his pinky finger. Now, the pinky finger, which is this finger here, is being supplied by your C8, okay? This pinky finger is supplied by the C8, the pinky finger, and then the lateral forearm. The medial part of the forearm, rather, is supplied by the C8, and that is the sensory dorsal part, which is your dermatomes. For myotomes, C8, injury to C8 is going to affect finger flexion, okay? Finger flexion. So the answer here is C8. T1 is actually your T1 is actually your inner medial arm, right, which is near the armpit, and also finger abduction and adduction also. That's for T1. C5 is your deltoid area, right, your deltoid area. Okay, your C6 is actually your lateral forearm and your thumb, okay, right, and also elbow flexion too, elbow flexion. C7 is this middle finger here, yeah, middle finger, and then your C8, which you just discussed now. So the answer is actually injury to the C8 muscles. Okay, so that's the answer for this question.